Over the past 17 months of the interim government, the Ministry, along with our permanent missions in New York and Geneva, has played an important role in this respect. We contributed to the high-level political forum on non-communicable diseases and provided valuable inputs in the drafting of the pandemic agreement. Our colleagues from the Health Ministry offered essential technical guidance throughout the process. Our efforts extend beyond multilateral platforms. During the same period, the interim government has actively integrated health considerations into bilateral relations also. The latest example could be the MOU with Bhutan on cooperation for health workforce. We also reached an agreement with China to build a referral hospital in Nilphamari that would greatly benefit the people of that region. On the other hand, we have also facilitated the treatment of more than 159 July fighters in 4 countries through bilateral arrangements. All this happened as a diplomatic response to the domestic needs of the country or as the health need of other friendly countries. Ladies and gentlemen, here I must revisit our experience of health diplomacy during the COVID-19 pandemic. The pandemic offered clear demonstration of the critical role diplomacy plays in health. Bangladesh, through its Ministry of Foreign Affairs and diplomatic missions, actively engaged in international forums such as COVAX and other regional mechanisms to secure vaccines and essential medical supplies for our people. This experience reaffirmed that the intersection of health and diplomacy is complex, and there is plenty of opportunities where the Ministry of Foreign Affairs and the Ministry of Health and Family Welfare can work together. I just want to frame the entire thing into 2 opposite but equally important aspects of health diplomacy: foreign policy for health and health for foreign policy.
টানা তৃতীয়বার অর্জন করেছে দেশের সেরা সুপার ব্র্যান্ড স্বীকৃতি বসুন্ধরা টিস্যু।
As our distinguished panelists will explore the case of Bangladesh from the perspective of global health today, I would like to share my thoughts on the topic as well. Whenever we discuss international partnership for health, the conversation often focuses on how our development partners have supported us so far and how Bangladesh has made remarkable strides. We invariably talk about expanded program of immunization, EPI, reduced maternal and under 5 mortality, and building of a robust health infrastructure across the country. Despite the challenges in some hard-to-reach areas, it is now a fact that both rural and urban communities have access to various health outposts. Of course, there are debates and constructive criticisms about their management and effectiveness, but one thing is undeniable, that our health sector has come a long way. Yet, we also recognize that the health sector still has a long journey ahead, especially when we have set universal health coverage as our target. This brings me to a crucial question regarding international partnership for health. Does our domestic investment and cross-border assistance benefit only Bangladesh? The answer is no. Bangladesh has not only benefited from the global health governance and support system, but we have also contributed significantly to global health. Let me vindicate this statement with examples. Number 1, our pharmaceutical industry now meets almost 99% of our national medicine needs. Beyond that, it supplies medicines to nearly 150 countries at affordable prices, making access to healthcare more affordable in those countries. Bangladesh will be able to contribute even more if we can nurture strategic partnership for developing vaccines, therapeutics, and diagnostics. Number 2, Bangladesh hosts the International Center for Diarrheal Diseases Research Bangladesh, ICDDRB, one of the most reputed health research institutes of the Global South. The knowledge it generates benefits not only Bangladesh, but the entire developing world. Number 3, the oral cholera vaccine developed by our scientists has the potential to be integrated into the global health supply chain, similar to how oral rehydration salts transformed the management of diarrheal diseases few decades back. If it is widely adopted, it could save billions of lives in public health hotspots around the world. Number 4, Through our peacekeeping missions in Africa, Bangladesh's armed forces have extended healthcare to local communities in those countries. They have contributed to building local health systems, including establishing and equipping hospitals. I am confident if we undertake research on how Bangladesh is contributing to global health, more examples will surface. It is therefore fair to say that investing in Bangladesh's health system has a global impact. Whether through health system development, the pharmaceutical industry, research and development, or clinical trial, our efforts have transboundary significance. Despite domestic challenges, Bangladesh has already demonstrated its capacity to contribute globally. This is why Bangladesh deserves to be an essential part of the global health supply chain and should be recognized accordingly. Ladies and gentlemen, Bangladesh has always promoted health as a global public good, and we will remain steadfast in this approach, whether in ongoing negotiations on pathogen access and benefit sharing, climate change, health linkages, next year's